The rising number of people who suffer from allergies. Specialist clinics have told us that for increasing numbers of patients, the symptoms are becoming more acute.
Well, for the final part of our series, we've got three experts to show us how sufferers can make their homes more allergy-proof.
We have moved from the Victorian days of cold, drafty houses to these warm, humid dwellings. And one species likes warmth and humidity even more than we do, and that is the house dust mite. Builders put this in, a polythene vapour barrier. In timber frame dwellings, people that are literally living inside a plastic bag. There is a technical fix to this problem, and that is to install, either in the roof space or in a cupboard within the dwelling, a mechanical heat recovery ventilation unit. Our grannies were right, fresh air is good for you.
I know that the bathroom's full of pitfalls for people who suffer from allergies. They're damp places, they're full of chemicals, and that can cause problems. Shower heads need to be kept clean. If you're an eczema sufferer, then chlorine can irritate the skin, but you can fit a shower filter to take most of the chlorine out so that your shower water won't be so irritating. If you've got an extract fan, make sure that you use it. You need to open the window as well. Close the door, make sure all the damp air goes out of the bathroom and not round the house. Think about the products you clean your bathroom with. If there's someone around with allergies, don't use strong chlorine bleaches and strong cleaning chemicals. There are cheaper, old-fashioned, equally good alternatives. White vinegar, that's good for cleaning tiles, mirrors, bathroom surfaces. Lemon juice, general cleaning and descaling. These sort of simple tips can really make a difference.
What you might not know is that within your bed and the general bedding area there could be 20,000 or more house dust mites living here. There's specific covers you can buy which are anti-allergy, which can go on top of your duvet, the pillow and the mattress. These are brilliant for harbouring house dust mite as well. The way that can be combated, that little fella could be popped in a bag, popped in the freezer for up to 24 hours and that'll do the job. Another thing within the bedroom environment which can irritate your airways is a chemical called formaldehyde, which is added to carpets and soft furnishings during the manufacture. Good way to combat this is if you've got a spider plant in the room, this absorbs it from the atmosphere. And one last thing, if you have any pets, any animals, we strongly recommend that you do not keep them in your bedroom.
Well, Dr. Adam Fox is an allergy expert, and he works at Guy's and St Thomas's Hospital, and is here to answer some of your questions. Lots of them coming in this morning. Thanks for coming in to answer them. This from Mercia in London. His son is 8. His hay fever symptoms started in February. Now he's got a very dry cough and a severe cold. Is that an allergy of some kind?
There's a good chance it is, particularly if it's happening just at this time of year, and this is something I've been hearing a lot about in the last few weeks.
Any guess as to what it might be allergic?
Well, it's probably the tree pollen, because the tree pollen season typically starts in about February time, and so if you're getting symptoms of blocked, stuffy nose, itchy eyes, starting to cough, maybe your asthma's getting a little bit worse, just in February, March, April, it's probably the tree pollen, and if it kicks off in April and carries on through May, June, July, it's probably the grass pollen.
Gloria has written in, she gets those symptoms. She says she finds an air purifier helps, particularly when she puts it on at night. Your view?
Yeah, I mean, lots of people find different things helpful. Air purifiers can help, especially if there's a lot of the thing you're allergic to floating around in the room that you're in. So maybe if you're allergic to cats or dogs and your cat or dog spends a lot of time in your room, then something like an air purifier may help.
They can help, right. My son's 3. I can count on one hand the number of times he slept through the night in the past year. He wakes crying with an itchy blocked nose. He does have food allergies and eczema. We have allergy covers for his bed, but I need help to resolve this so we can all get some sleep. We don't have any pets either. How can I remedy this? Hannah in Bath.
This is something I hear a lot about in the clinic, because if you've got one allergic disease, there's a very good chance that you've got another. So people come to our clinic because they're concerned about their child's eczema, and we end up diagnosing them with food allergies as well, or they come in with food allergies and we find that they've got something like allergic rhinitis. So exactly the sort of symptoms that are being described there.
Well, sorry.
Well, the thing is that what's important is to try and get a diagnosis, to do some allergy testing, identify what the problem is. But it sounds as though this child's going to need a little bit of treatment beyond just covers for
Is that
beds.
the RAST test, the blood test, or the skin test you're talking about? I mean, what should people be asking for when they go to their GP?
Well, there's two validated tests that we can use for testing for immediate allergies. One is a skin prick test, which is usually only available at more specialist clinics, so the GP is unlikely to be able to offer you that directly without referring you off to the hospital. But they may be able to do what we call specific IgE or RAS test, which is a blood test that they would have available at the GP.
David in Dorchester's got a slightly awkward problem. He's never been bothered by dust, but occasionally he gets a sneezing fit that may last for up to a quarter of an hour. Says sometimes it happens when I open a book that's been on the bookshelf for a long time, which sounds like it would be dust.
Yeah, it probably is, absolutely. But what some people find is that if they've got an underlying problem of an inflamed allergic nose, that whenever anything gets up there, they get sneezing fits. So it may not be specific to
15 minutes is a
something
long time to sneeze.
Yeah, that's a lot of sneezing.
Yeah. Now, we have been inundated with emails today, and a lot of people and some have got quite obscure sounding things that they're allergic to. What have we got any nearer to understanding why? It hasn't always been this way, has it? Because, the numbers just seem to be increasing sevenfold in some cases, and particularly on the most dramatic side, the anaphylactic shocks.
There's certainly more allergy around, and if you go all the way back to the 19th century when a doctor called Bostock first described hay fever, it took him years and years to find just a few cases to publish in the Lancet, whereas now 25%, something like that, of the adult population in the UK suffer from hay fever.
So what's going on?
Well, I'd love to say that I know the answer. Unfortunately, some of the theories that are being touted have got holes in them, and even the hygiene hypothesis or the clean child theory, the idea that because our environment's got much more clean, that our children are exposed to less dirt and less infectious disease, we end up with less mature immune systems that start becoming inappropriate. But
right. For hay fever sufferers in the summer, is there anything to the theory that having local honey with local pollen in it can help you? Because anecdotally people say that works for them.
I have to say, I think that it has a minimal effect, if any at all, and there are lots of helpful treatments out there, and it would be a shame to divert attention away from those, because getting the right sort of antihistamine, nasal spray, or even looking at desensitisation can make a huge difference for people with hay fever, rather than relying on perhaps more traditional remedies.
Okay.
And hopefully we get some more research to really try to get to the nub of the problem
Absolutely.
sooner than later.
Yeah.
Adam Fox.